I'm Savannah Sellers. Thank you very much for being with us this Monday. And we do begin this hour with some breaking news on those American citizens who were stranded on that hontavirus-hit cruise ship. In the last hour, officials from the Department of Health and Human Services provided an update on the situation from Omaha, Nebraska. That is where some of the Americans were transported to and continue to quarantine. Their message, the public health risk is very low. Take a listen.
Let me be crystal clear. The risk of hantavirus to the general public remains very, very low. The Andes variant of this virus does not spread easily, and it requires prolonged close contact with someone who is already symptomatic. Even so, we have taken this situation very seriously from the very start. With the safe arrival of these U.S. citizens here in Nebraska, CDC teams are working side by side with ASPR, with UNMC, and with state and local officials to conduct assessments and provide ongoing monitoring and care.
Let's bring in NBC News correspondent Daniele Hamamdjian. She joins us now from the Canary Islands. Danielle, good morning. Thank you so much for being with us. So we did get quite a bit of information. Officials took quite a few questions there, HHS officials as well as officials from the University of Nebraska Medical Center, where we understand 15 of those people who returned to the United States are in a quarantine unit. 1 is in a biocontainment unit, and 2 have been transferred to Atlanta. Walk us through the details that we got this morning and about how the U.S. is treating these American passengers.
I will, Savannah, in 1 minute, but I just want to set the scene here where I am. As you can see, it is very windy here in Tenerife, and behind me is the ship that has been anchored since yesterday morning. And just in the past few minutes, we saw a tugboat with crews in hazmat suits heading towards the ship to begin what we believe to be now the final step of getting the 28 passengers and crew members off the ship. Officials were worried all weekend about a weather system moving in that could potentially delay the evacuation. Just in the past 30 minutes, the weather has certainly changed, becoming very, very windy. There are 2 planes leaving today, and both are going to the Netherlands. It was supposed to be 1, it's now 2. And there are staff from the Dutch embassy here at the port. We've spoken to them, and they were just waiting for those planes to land, for those people to disembark, but it looks like it's going to happen very soon. Shifting back now to that press conference we just heard. First of all, clarification on the number of Americans who were on board. We thought that it was 17, 18 in all now, because we know that there was a dual citizen, 16 in Nebraska, as you mentioned earlier. Among those 16 are 15 who are staying in hotel-like rooms. They are asymptomatic. They do not have any fevers. They all are still resting at the moment. 1 is in a biocontainment unit, having tested positive. They are doing well. They are not, however, showing any symptoms. This is what U.S. authorities, U.S. officials had, health officials rather, had described as a mild positive. The reason being is that there were 2 tests done on this individual. 1 came back negative, the other one positive, which is why Spanish officials did not count this person as a positive. Now, a question many had, including ourselves here, is how long the isolation period or the quarantine period would be. It's now clear that there is not going to be a quarantine enforced. It'll be on a case-by-case basis, but certainly what's clear is that they'll effectively be able to split their time between this facility and their homes in coordination with state officials. Savannah.
And Danielle, quickly, also news that we had this morning. We, of course, were just getting the American briefing, but there is a woman in France who has been hospitalized as well. Give us the update there.
Yeah, and Spanish health officials had said that during the journey from Cape Verde, which was their last stop, to Tenerife, there was no PCR testing done because they just didn't have the capabilities. But experts on board were checking in and providing updates every 12 hours. There were no passengers with any symptoms. This woman from France also did not have any fever. However, within hours yesterday of having stepped off that boat onto land and almost immediately onto buses and then repatriation flights, it was clear that she did develop a fever on board on her chartered flights back to Paris. That was an announcement made by the country's prime minister. And less than 24 hours later, an update that this woman has indeed tested positive and her condition is deteriorating. I do want to point out that we are hearing reports, however, that a British man who had tested positive and is being cared for in South Africa is showing signs of improvement. That is according to Reuters. We cross our fingers that that is indeed the case, but good news there, Savannah.
Absolutely. Thank you for that bit of good news. Danielle, thank you very much, joining us from the Canary Islands, of course, where that cruise ship is docked.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.